So great. So let's talk about some of the non-medical interventions, which is actually the important part of how we manage alcohol disorders. And we all know that you sitting and just withdrawing them off the alcohol for those 5 days is not going to make much difference. And so the physical addiction is the least of the worries. So everybody quite often focuses on that. But once you've got them off the physical addiction, how do you now help them to not go back as that as their main coping strategies? And there's a lot of different therapies that's been shown to be effective. So anybody who can help this patient find different coping strategies and figure out what is contributing to them needing to use this alcohol and helping them with proper support system is going to make a big difference. What's made a huge difference is group therapy. We know is very useful for alcohol disorders. And particularly because remember I said alcohol has got quite a lot to do with this feeling of abandonment and rejection. And so something about building a support structure is actually extraordinarily helpful as a coping mechanism. And there are two main, I would call it two extreme views of how this group therapy should work. And they're completely oppositional. So we're going to look at the two opposing camps. They draw on completely different paradigms of how they think one should manage alcohol. No one is better or worse than the others, but definitely it's different for which ones suit which patients. So you got to know who your patient is or how your patient thinks about the world to know which kind of methodology is going to be more helpful. I think in South Africa, it's not quite so dramatic. So the Alcoholics Anonymous, the 12-step program in America, has got a very particular 12-step program that they follow. I think South Africa, different AAs are more or less extreme, depending on who runs it. And so generally in America, there's these two possible things you can do. You can either join the AA, or you can join something called the Rational Emotive Therapy. And quite often it gets pitched depending if you're more of a believer or if you're more of a thinker in terms of which group therapy is going to be the most helpful. So it's just to show you what the 12 steps looks like. There are some issues in the 12 steps that is considered a concern for some people working within substance abuse. And you'll see there the 12 steps has got a very much embedded around a belief in a higher power. So already in step 2, you believe that there's a power greater than yourself that will restore you to sanity. You know, classically in AA, you stand up and go, I am an alcoholic, I'm an alcoholic for life, and you identify with alcoholic as part of your identity. So this is one way of looking at it, and you hand yourself over to a higher power. So somebody who's religious and is within a church structure, this could be an extremely powerful way to help and assist them with that. What's happened in America, and which has been a challenge, is for people who are not necessarily that way inclined, finds it then difficult to relate to AA. And so there's a lot of people then who got lost because they were struggling with some of those concepts. One of the issues with the AA system, which is definitely recognized in substance abuse, is that there's this idea of the more days you are free, the better. So you get these badges. So say you haven't been drinking for 5 years, and then suddenly you have a day where you drink, then you lose your 5 years, you know, and you start counting again from scratch, the days of sobriety. Well, actually, statistically speaking, if you've only drank 1 day out of 5 years, that's very good. So there's a much more, the rational emotive therapies, I clearly have a little bit of a bias towards rational emotive therapy, because it's very much based on a supportive, affirmative view. And rather than viewing addiction as an identity, it's understanding it as a coping mechanism. So I do not define alcohol as a disease. It doesn't see alcohol as a lifelong condition. It looks at this variety of factors that make people more vulnerable to drinking. And it's got this huge concept of what it causes is it manages your irrational self. So remember I talked about the dragon. They have this acronym called the beast, and how you recognize this inner beast that wants to drink to try and manage its emotions. And then to address the beast, they look at training. So they also have group therapy. You don't have the same thing of identifying yourself as an addict, but you identify sobriety as your higher cause. So my higher cause is to not drink at all, but I see this as ways of dealing with my irrational self. So they train patients. It's very much similar to cognitive behavioral therapy, being able to understand what triggers it, being able to understand what they call addictive voice recognition training. What is the voice of this beast? You know, oh, I can't believe I'll never be able to have a glass of wine in my life again, or, you know, only one drink won't do any harm, or sort of having all of these different things people tell themselves and actually working actively with those irrational thoughts. There's a very big emphasis on building self-control and self-worth and yourself as not a defected being, but actually a fully capable, amazing being that just has this coping mechanism you need to work with, and this real focus on sobriety. So this is quite interesting. These are some of the irrational thoughts that they counter. So, and there you can see some of the differences with with AA. So for example, some of the irrational beliefs that AA fosters is things like, I am powerless. If I have one drink, I will relapse. I'm alcohol dependent for life. Where rational emotive therapy is like, no, actually you have full power over your own hands and mouth. You can decide what needs to happen. Quite often people with will think, oh, I can't possibly manage the withdrawal. And then, oh, hold on, physical withdrawal is not that bad. It takes 2 or 3 days. Nothing's going to kill you if you're emotionally sad for a few days. So there's a lot of working with some of these irrational thoughts. What's interesting within rational emotive therapy, because it's based on the rational emotive therapy is actually a therapy type, is that there's a lot about rationally working with these irrational ideas that I should never fail, other people should never fail, I should never make a mistake, everybody should love me, life should be perfect. You know, we have all these funny irrational thoughts that quite often makes us upset when things are not the way we want. Then we go and have a drink. So there's a lot of work around personal development and understanding emotional regulation. So almost there. I've got one slide on structural interventions, and then I've got literally 3 slides on how to do a behavioral intervention. This is just interesting that during lockdown, they showed that unnatural deaths dropped from 800 to 1,000 per week to 400 per week. So during COVID, we had a natural experiment in what happens if we restrict heavy drinking. So when they do studies about heavy drinking, most heavy drinking happens late at night, happens off-site, usually at a restaurant or a shebeen or stuff like that. And of course, we can't influence what happens in people's homes, but by blocking the sale of alcohol very late, by blocking the movement of people very late, it had a dramatic effect on alcohol-related deaths in this country. It's actually frightening in terms of interventions. In comparison with almost any other medical intervention, this was extraordinary. So the WHO has got something called the Safer Strategy, which many advocacy organizations in South Africa has adopted. Government keeps on making noises in this direction, but it's not yet translated into legislation. And there are laws that sort of sitting on the back burner at the moment that there's a big push to get them through. So SAFER it's an acronym, S standing for strengthening restrictions, so limiting the hours and days of weeks of sale, getting that driver level down to 0.02 with proper policing of that. They've shown that bigger containers is linked to heavy drinking. So actually restricting, you know, at the moment, Black Label, for example, has made a 500 ml beer that you can buy that's the same price as the 440. So there's a big emphasis on you can buy, you know, it's cheaper to go and buy a pint than a beer. Obviously looking at screening, interventions and treatment, enforcing bans on alcohol advertising, like our sports events at the moment, that's got alcohol all over it. And of course, raising the price of alcohol. And we know that these measures work. So one of the countries that massively reduced their alcohol-related dependence and mortality was Russia in 2002. They had a massive vodka problem. And due to a lot of these restrictions, they've actually managed to massively reduce some of their issues. So we know that these structural things work and need to how to make that possible. So lastly, and again, I